Hello, I'm your CARES coordinator, and today I will review a hospital demo with you. For a little background, CARES stands for the Cardiac Arrest Registry to Enhance Survival. CARES is a collaborative effort of the Centers for Disease Control and Prevention and Emory University College of Health Sciences. The ultimate goal of CARES is to improve survival from sudden cardiac death. The registry is designed to help local EMS administrators and medical directors identify who is affected, when and where the cardiac arrest event occurs, which elements of the system are functioning properly and which elements are not, and how changes can be made to improve cardiac arrest outcomes. CARES utilizes an internet database system that reduces the time involved in registering out-of-hospital cardiac arrest events, tracking patients' outcomes with hospitals prospectively, and response time intervals associated with first responders and EMS agencies. Multiple reports can be generated and monitored in real time through secure online access by CARES participants to allow for longitudinal internal benchmarking. Now I'd like to direct your attention to our website. This is mycares.net. When hovering over the tabs we have available here, such as CARES Overview, as you can see, we have our CARES participant map, our fact sheet, some letters of support available for our end users. We also have tabs specifically available for our state users, EMS users, but today I'm going to specifically review the hospital tab. On the hospital tab, as you can see here, we have our general brochure, our hospital FAQ, our sample reports, our hospital user guide, and some of our supplemental modules. On the data tab, this is an easy way to access our annual reports as well as our national reports by year. On the vendor tab, we have things specifically for our vendors to use. And then lastly, on the Contact Us tab, we have information for CARES staff and state coordinators, but feel free to reach out to your CARES state coordinator or program coordinator directly. Each user has a unique username and password. CARES does not share data between agencies or hospitals. All data is locally owned and confidential. When giving a hospital demo, we use a dummy account that contains no live data from a participating hospital. Just as a refresher, a CARES case is a non-traumatic worked arrest where resuscitation was attempted by a 911 responder. By resuscitation, we mean CPR performed by a 911 professional and/or defibrillation by anyone. That would be a layperson or 911 responder. Now I want to direct your attention to the dashboard here. When looking at the dashboard, as you can see, it's organized by the date of arrest, the patient's name, the date of birth of that patient, the EMS agency that transported that patient, whether this was a transferred case or not, and whether this record has been started or not, meaning it has been edited or not by the hospital. All information on the dashboard is updated in real time as data is added, edited, or deleted. Upon clicking the pen and paper icon, you'll be directed to the hospital portion of the CARES form. As you can see here, there are some gray backgrounds and blue backgrounds. All that is in gray is required, and all that is in blue is considered supplemental. Starting with 47, the ER outcome, if the patient died in the hospital, you are done with all of the required questions for this CARES form, and this can now be considered complete and clean unless you want to move on to the supplemental portion of the CARES form. If the patient was admitted to the hospital, 48 and 49 are now open for you to answer those questions about the patient's hypothermia care and the hospital outcome. Lastly, for 47, if the patient was transferred to another acute care facility from the ED, you do have a drop-down menu here available so that you can select which hospital that patient was transferred to. Now, if the hospital is not in the drop-down menu, then you are able to select the free text field here and fill out which hospital that patient might have gone to. Now, once you select the transferred hospital for the patient, that patient will no longer be in your queue. It would actually go to the hospital where the patient was transferred. Now moving on to 48, we're simply asking, was hypothermia care initiated or continued in the hospital? And that's just a yes or no question. For 49, if the patient died in the hospital, again, you're done with all the required questions for CARES, and you can select save or move on to the supplemental portion of the CARES form. If the patient was discharged alive, you would move on to 50, answering the discharge from hospital information. If the patient made DNR, as you can see, a drop-down menu frees for you to open up here. You can select whether the patient died in the hospital, discharged alive, transferred, or not yet determined. Again, if the patient died in the hospital, you're done with all the required questions for CARES. If the patient was discharged alive, again, you would be moving on to 50, answering the discharge from hospital information. If the patient was transferred, we get our drop-down menu here again, and we're able to see all of the transfer hospitals, and we're able to use the free text field. If the status of the patient is not yet determined, you're able to select not yet determined, and this patient will be on your dashboard until you fulfill all of the information needed for that patient. Moving on from patient-made DNR, if the patient was transferred to another acute care hospital, then again, the drop-down menu for hospitals is listed here, as well as the free text field. And again, if the patient's information is not yet determined and they're still in care of that hospital, you're able to select not yet determined here. Now, if the patient was discharged alive again, moving on to 50, we'll answer the discharge from hospital information. Did that patient go home, to a rehabilitation facility, or to a skilled nursing facility? And once we're answering that question, we're able to go on to 51, answering the CPC score for the patient. We do understand that it might be a bit difficult to collect neurological information, so we do group CPC scores 1 and 2 together, as well as 3 and 4. Once you're done with 51, you have answered all of the required questions and can move on to the supplemental fields or choose Save for this form. We do have a bit of logic incorporated into the CARES form. And so, for example, if the patient went to a rehabilitation facility or skilled nursing facility, however, we do select 51 that the neurological outcome is good or moderate, we do have a pop-up block that says, you have coded that the patient was discharged to a skilled nursing facility or hospice, but the patient had good cerebral performance at the time of discharge. This appears to be conflicting information. Please clarify in the comments box. You can go ahead and select OK there and clarify in the hospital comments box. We do understand that sometimes this may be the case, but again, it seems a bit conflicting, so we do ask for further information there. The same exists for coma vegetative state and then selecting home or residence. And it says here for the pop-up, you have coded that the patient was discharged home, but the patient may have had severe cerebral performance or in a coma at the time of discharge. This appears to be conflicting information. Please clarify in the comments box. You can select OK and fill out that information in the comments box. Now I would like to direct your attention to the supplemental portion of the hospital form. As you can see, we ask a few questions about the hospital procedures here. You can simply answer these questions by using the radio buttons and free text fields available. We have things about CABG being performed, with an ICD placed or scheduled, and you can also list the hospital medical record number for the patient if you have it available here. And as I mentioned earlier, we have a hospital comment section. If you have anything to report about this patient, anything that was in the narrative that you would like to list about the patient, or anything that was special that happened during this arrest that you would like to list in the hospital comment section, you do have it available to you. The last thing I would like to mention here is the Unable to Locate Patient button. There are moments where we can't locate the patient at the hospital, meaning that either that name or date of arrest or date of birth of the patient is not showing up in your system. So if that is the case and you are unable to locate this patient, please select Unable to Locate Patient and save this form. This will then be sent to the EMS agency, and if they have further information about the patient, they're able to give it to you, or if they have to correct the destination hospital, that will happen as well. If you have any questions about this portion of the CARES form, please let your CARES coordinator or state coordinator know. A record is only pushed to the hospital if EMS enters end of event, ongoing resuscitation, and the ED. If the EMS agency is aware that the patient died in the ED, they can select this outcome and reduce the hospital's data entry. Every record is reviewed by an audit algorithm to ensure consistency in data review across the entire registry. Any errors detected will appear on the page when you successfully save a case. We encourage you to immediately go back to the CARES form to correct any flagged questions. As you can see, upon selecting Save here, I receive a flag letting me know that 51 was not completed on the page before. I can either return to the CARES form or go back to my dashboard. I'm going to go back to the CARES form. And as you can see, we have an error description here at the top letting us know that 51 was not completed, and we also have it highlighted in the form in red showing us that 51 is not complete. I can select my answer appropriately, select Save, and as you can see, no errors occurred when we saved this form successfully, and I can now go back to my dashboard. When we're back at our dashboard, we can see that the record that we chose to edit is no longer on our queue. Now, I would like to review the CARES search function with you. If you hover over eCares, as you can see, we have the CARES search as well as the CARES advanced search. The CARES search includes all the required fields, while the CARES advanced search includes required and supplemental. For the purposes of this demo, I will use the CARES search. As you can see, we have all of the CARES fields listed here, meaning that you can search for a number of patients and do further analysis as needed. If you would like to use our filters, the drop-down here includes presumed cardiac CARES cases, non-traumatic CARES cases, a scene arrest, and list of survivors. We have a drop-down here for date of arrest. You can either choose the custom date range that you would like, or you could use one of the pre-selected categories we have here. For the purposes of this demo, I'm going to select all for date range, and I would like to look at patients who were discharged alive and had good to moderate cerebral performance. I'm going to choose search, and here are my results. As you can see, 6 records were found that met my criteria. As you can see, this page is organized by incident number, date of arrest, and patient. For all of those that have a comma, that means that this record has been de-identified and scrubbed of name and date of birth. For those that still have names attached, it still needs to go through the auditing process to be scrubbed with PHI. If you would like to look at these records all at once, rather than clicking one by one in the Edit Form section here, you can send these results to an Excel export of data. If you choose Excel export of data and then Go, an Excel export will pop up for you here. As you can see in the first row, all of the CARES questions are bolded. If you would like to do further analysis or make any custom reports, you have the ability to do so here. If you would like to save this to your desktop and use it at a later date, that's possible for you as well. Please be sure to turn off your pop-up blockers to access this. Lastly, I would like to review the CARES reports with you. If you hover over reports, you see we have the hospital survival report available as well as the hospital benchmarking report. If you select hospital survival report, you're taken to a simple query here. As you can see, you can select hospital data or national data. You can only select either or. For the purposes of this demo, I'm going to select hospital data. We also have date of arrest here. You can choose a custom date range or use our drop-down menu with one of the pre-selected categories here. I'm going to choose last year. You can choose direct from EMS patients or transferred from another facility or all. I'm going to keep it for all here. And then presumed arrest etiology, we have the non-traumatic CARES cases as well as the presumed cardiac CARES cases. I'm going to keep it at non-traumatic here. Once you select generate report, you're going to get a pop-up block stating that the report uses recent data and are not completely audited and therefore are incomplete. Please recognize that data by calendar year is not finalized until April 1st of the following year. For example, reports including data from 2013 will not be considered final until April 1st, 2014. If you select OK, the report will generate. As you can see here, the hospital survival report is organized like a flow diagram. At the top of the report, we have the total number of CARES patients down to the sustained ROSC and field patients. And then as you can see, it divvies out to shockable rhythm versus non-shockable rhythm. Those patients that were admitted to the hospital, the in-hospital and no hospital in-hospital hyperthermia, and then those patients that died in the hospital, those patients that were discharged alive, and then the neurological status. On the second page here, we have those patients that had no sustained ROSC in the field, again divvied out into shockable versus non-shockable initial rhythm, those patients that died in the hospital, those patients that were admitted, the in-hospital and no in-hospital hyperthermia patients, died in hospital, discharged alive to neurological status. Now let's review the hospital benchmarking report. Similar to the CARES survival report, we have a simple query here. With the hospital benchmarking report, we can juxtapose the hospital data with the national data set. If we choose yes for hospital data, as well as yes for national data, and then date of arrest, I'm going to go ahead and choose last year's data set. We can choose direct transferred, so direct from the EMS or transferred from another facility, or we can keep it at all. I'm going to select all here. Presumed arrest etiology, non-traumatic CARES cases or presumed cardiac CARES cases. I'm going to choose non-traumatic CARES cases, and then we can include the supplemental elements, and I'll choose yes here. Then generate report. We get the same caveat that we did for the survival report. Reports using recent data are not completely audited and therefore incomplete. Please recognize that data by calendar year is not finalized until April 1st of the following year. For example, reports including data from 2013 will not be considered final until April 1st, 2014. Let's select OK. As you can see with this sample report, we have the in-hospital characteristics followed by the pre-hospital characteristics here. And again, since we selected supplemental, we have the supplemental fields listed here at the bottom, and this is all juxtaposed with the national data set. With the in-hospital characteristics, we can see what happened to the patients that died in the ED, those patients that were admitted in hospital hyperthermia care, patient made DNR, in-hospital mortality, those who were discharged alive, and the discharge with good to moderate CPC scores. Again, this is juxtaposed against the national data set. The pre-hospital characteristics just gives us some demographic information, whether this was a shockable or an unshockable case, the witness status, and hyperthermia care initiated in the field, and again, juxtaposed against the national data set. And if your hospital is collecting the supplemental fields on the regular basis, then we do have the ability to juxtapose against those supplemental characteristics, which are awake and following commands, unshockable rhythms, a cardiac stent placed, CABG performed, and things of that nature. Again, with this benchmarking report, similarly to the survival report, you can print this off or download it to your desktop and use it however you would like. This will conclude the CARES Hospital demo. Thank you for your time. If you have any questions at all about anything that was covered today, please contact your CARES State Coordinator or CARES Program Associate. Thank you for supporting the CARES Registry. Have a great day.